Hi, I'm Sebastian Ryder, Director of Sales at the Transplant Diagnostic Division of Thermo Fisher Scientific. As you know, the field of transplantation is changing quickly due to increased waitlist times, a growing demand for fast results, and the many challenges introduced by the pandemic. Now more than ever, we believe it's crucial to bring the transplant community together to change and save lives through innovative thinking, strategic partnerships, and cutting-edge research. That's why I'm excited to tell you about all the ways that we're evolving our business to help create a safer, healthier, better tomorrow for your lab and the patients that you serve. As next generation sequencing usage grows, some labs are finding that NGS methods are difficult and time consuming. Our new all-type FastPlex next generation sequencing assay has been designed to make your workflow easier and simpler. The protocol eliminates most of the pipetting, purification, and quantification steps that are required by traditional NGS methods. It also allows you to pull amplicons in a single tube during the first hour, which reduces your hands-on time to less than 90 minutes. The workflow is so simple that anyone in your lab can learn how to run it. We're excited about the way this new product will make your workflow easier and allow you to generate high-quality results with less time and effort. For antibody detection, our new LabScreen single antigen XPlex assay builds on the trusted LabScreen platform to offer extended multiplexing capabilities and a more inclusive panel. In a single well setup, the XPlex kit allows you to expand your reach for a total of 151 Class 1 alleles and 119 Class 2 alleles. The extended panel provides more data, which means your antibody results may better complement typing results and can also be used to research eplet patterns. The XPlex assay follows the standard LabScreen workflow, so it can be easily integrated into your lab's protocol on the LabScan 3D. While we're looking forward to seeing how the LabScreen XPlex kit improves DSA testing, we believe there's an even more fundamental problem facing transplantation today. The pandemic has made it increasingly difficult for labs to provide post-transplant care while also performing research on how HLA variation might affect COVID-19 patients. That's why we've launched several new initiatives to support education and research on COVID-19. We've recently published a white paper on a body of research that suggests HLA and HNA may play a critical role in COVID-19 susceptibility, immune protection, and novel therapies. To check out our white paper and review the research, visit go.onelambda.com/ASHI. As you know, researchers around the world are working hard to clarify the association between HLA and COVID-19. We've partnered with a consortium of HLA and immunogenetics professionals in academia, research, clinical labs, journals, and international societies to create a centralized resource for all of these ongoing studies. The site, hlacovid19.org, will help to aggregate data produced by scientists across the globe and will unify our collective efforts to defeat the virus. For more information, please visit hlacovid19.org. We're excited to announce a new research collaboration that we hope will advance our knowledge of the virus and its impact on transplant patients. Along with our partners, Emory, Stanford, and Cincinnati Children's Hospital, we're studying how antibody detection can be used to stratify risk and measure treatment efficacy. This data could be crucial for transplant recipients whose COVID-19 fatality rate is twice that of the general population. It may also help labs and clinicians assess the risk for transplant operations and make decisions about immunosuppressive treatment. And finally, in an effort to support the patients you serve, we're engaging in partnerships that will help transplant recipients stay safe while adhering to their post-transplant testing plan. We are working with transplant centers across the US to facilitate an at-home blood draw service for HLA antibody testing. This service will be available to all patients who want to continue their post-transplant monitoring without going to their usual dialysis or transplant center. They can order the test through their transplant team, and with a single phone call, they can arrange for a phlebotomist to draw their blood at home. The current public health crisis has challenged us all to think bigger and act faster so that we can provide solutions for transplant patients and their families. If there are additional ways we can help, please let us know how we can work with you to create a better tomorrow for your transplant center, your lab, and your community of colleagues and patients.